Welcome back to Living Out Loud. I'm Susan Karp, the Executive Director of the Arlington Council on Aging. Today we have a special guest. Marie is a nurse at Mount Auburn Hospital. The reason Marie is here is because Mount Auburn has been gracious and granted the Arlington Council on Aging a mini grant to help with stroke prevention and awareness. So Marie, I would like to welcome you to our program. I would like to basically pass the baton on to you since I'm not a nurse and I can't tell everyone all that you know.
Okay, well,
so
thank
welcome.
you. Thank you, Susan. May is Stroke Awareness Month, and so we have a big campaign going out to educate as many people as possible. Stroke is a medical emergency. We want people to identify the risk factors and the warning signs for stroke and to be able to get to a hospital as quickly as possible to save their time. In the stroke world, time is brain. And
so time is brain. That's something that we really want to remember. Time is brain.
Yes. Every second your brain goes without blood or oxygen causes severe deficits, life-altering deficits. And so we want to make people aware of what some of the warning signs are and what they can do to help themselves or someone they love get to a hospital and get medical treatment as quickly as possible.
Oh, all right. So what are some of the signs?
So we're going to use the acronym FAST, and it's one that has to do with face, arm, speech, and time. So any facial droop or any sudden change in your face, arm weakness, you can't hold your arms up, any speech difficulties, you sound like you have garbled speech or the words coming out don't make sense, you want to call 911. You want to call someone as quickly as possible, an emergency EMS person to come to your house to evaluate you and get you to a hospital as quickly as possible.
So are you suggesting that anytime any one of those, let's say face?
Correct.
So when someone's face is drooping, is it pronounced? Is it slight? Is it?
It can be slight, but usually it's a sudden pronounced change in the symmetry of their face. So what we sometimes suggest people do is if they feel like a numbness or a sensation in their face and they're home alone, what we would like them to do is go to a mirror, look in a mirror, smile. If both sides of your face aren't symmetrical or don't both go up at the same time, that's a concern. That could be the facial weakness.
Okay, and now I'm going to cheat here because Mount Auburn has been very good to give this. So the arm. So you said if one arm is weak. So when you're talking about one arm being weak, does that mean just feeling like it's a little heavy, or does this mean that the arm literally can't
It can
move?
it can be a little bit of both. What we tell people to recognize is a sudden change. So sometimes if you have any usual weakness in your arm, that's something you live with daily. That's not a sudden change, but all of a sudden you're in the middle of brushing your teeth, combing your hair, you're sitting, and all of a sudden your arm feels really heavy, that you have to actually pick it up, or you have a sudden change in the numbness of your arm.
Almost feels as though if you were to sleep on it at night and you
Correct.
wake up and it feels numb and heavy.
Absolutely. That's
Okay.
a sudden change. That could be the sign of a stroke. So what we ask people to do at that point, if you have that, we ask you to put your arms up, and if one
like
arm,
this?
right, just like this, and if your arm can't stay up, if you can't hold it up, that's a sudden change. We want you to call 911.
Okay, so that's the A of the acronym FAST.
Correct.
So let's talk about the speech. Now you mentioned that if the speech sounds garbled or if the words aren't coming out right. So does this mean that the speech, someone could say, instead of saying, gee, it's a sunny day, would it be, gee, it's a funny day? Or would it be something a little bit more pronounced than that?
So sometimes it's not necessarily just a change in the word that you want to use. Sometimes it's the words that are coming out are completely garbled. You want to say the sky is blue in Boston, and you say something like blah 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 blah. The words are not intelligible words. You don't know what they are.
Okay.
Or it can be that you have a slur to it, like you're trying to say as a hesitancy to the words.
Okay, so all of a sudden that fluid speech of it's sunny in Boston.
The sky is blue in Boston.
Okay, well I didn't
That's
pass
what
the
we
mini
that's
cog.
what we
All right,
love to
I just
say.
failed that one. We'll talk about that on another day. But on a serious note again,
Yeah,
it's
right.
Okay, so it's more of the slow.
Correct.
Right. So
hesitancy, slurred speech, or intelligible words that don't make any sense at all.
okay, so that's the S in the acronym FAST.
Correct.
So then time is brain.
Time
so
is brain.
Talk to us about that.
So what we would like you to do, or a loved one that's with you, or if you're anywhere, if you're, at Stop and Shop, or if you're somewhere else and you have these sudden changes, part of what we're trying to do is make the public aware of these changes. You want to ask them to call 911, or if they're with you or you're with somebody else, you want to call 911. You want to get EMS to you as quickly as possible. They come, they assess you. They can take your blood pressure. They look at potentially what your deficit might be, and they provide medical treatment right there on the scene at your house or wherever you are. The biggest factor with that is because time is brain, they call ahead to the local hospital. Mm-hmm. Mount Auburn's a primary stroke hospital. We see many, many, many strokes every year. They're going to call ahead to us if we're in that area.
Yep.
Could be anywhere, any hospital. They're going to say, we have a 35-year-old female who has a sudden change in. We're bringing her in. We think it could be a stroke. So what happens behind the scenes in the hospital is we start getting our teams together. We get the doctor together. We get a nurse together. We call ahead to CAT scan. We're going to be meeting you at the doorway.
Yep.
Waiting for you to come so that we can triage you as quickly as possible, get you into imaging or CAT scan or something to look at your brain to see what's going on.
Okay.
Very, very important. Don't wait. The problem, most of the barriers with stroke is that people wait and they don't come to the hospital. And there are many reasons why people wait. And I have heard probably every reason you can imagine. Most of the time people don't want to call EMS because they don't want their neighbors to know. They don't want police and fire and ambulances coming to their house. They don't want to bother anybody. Mm-hmm. They want to wait till somebody comes home from work, or they want to call their daughter the next day, or they think maybe it'll get better. If they have other medical comorbidities, maybe if they have something like diabetes, maybe they think their sugar's low. So they're going to have a glass of juice. So they're going to wait. And once again, time is brain. And they wait. And there are only certain things, certain medicines that we can give you in a very short period of time.
Now, I may be putting you on the spot, but
No.
What is that short period of time between the period of last
Known well, last known
well?
well.
So
right?
that's another term, last
Correct.
known well.
Right. So when the symptoms, literally when the symptoms started, and that's a big thing that we tell EMS to get by bystanders or family members or someone that's with that person, hopefully. Mm-hmm. When did you last see this person normal or well?
Okay.
So from the time that we can hopefully identify as the last known well and or the onset of symptoms, mm-hmm. when that happened, to the time that we can give this medicine is there are various, kind of time constraints, but usually within the first 3 hours.
Within the first 3 hours.
Of the onset of that symptom.
Of the onset.
So you have to identify that you've had a stroke. Let's just say you've had a stroke at 10 a.m. You've had that sudden change. Mm-hmm. You call EMS. They come to your house. They get you to the hospital by 10:30. Traffic assessment, whatever. We're waiting for you. We get you into CAT scan. We have neurology and the ED doctor and et cetera. We know that it's a stroke. We start mixing the medicine as quickly as possible. They have to give you an IV. You have to have labs done. So there are time issues. And then we want to get that in as quickly as possible because every second kills brains.
So time is brain again.
Kills brain cells, and once those brain cells are dead, they do not come back. They're gone. Hence the deficit that people are left with because that core area of the brain mm-hmm. dies.
That's a very powerful message.
I know.
Very powerful message. So what we're learning today is time is brain. Mm-hmm. So from the point of where the face has changed, the arm weakness, the speech has changed, you have basically 3 hours between mm-hmm. those changes and the time when you need to be providing medication to counteract.
Correct.
So is there always a win-win situation when you're within that window of 3 hours, or is it just reducing the total effect that the stroke is causing on the brain?
So I guess that would be a twofold question, twofold answer. Sometimes patients stroke is a pretty big stroke, and we still give them medicine, and it may not, they may not regain or get back to as normal as they could be, but it will usually improve whatever deficit that they may have.
Well, and I guess we shan't flirt with fate
No.
and make our own decisions about when it's the right time
Right.
and what
That's-
the medicine will do.
Correct. That you can't worry about that. You just need to get to the hospital.
Right.
The another sort of thing I want people to think about is every 40 seconds in the United States a person has a stroke.
Every 40 seconds.
Every 40 seconds. It's the number 5 cause of death. So the 5th leading cause of death, and it's the number 1 cause of disability.
Wow.
Right.
Wow.
So it's a medical emergency. Any sudden change, you need to call 911. And I tell people when I go out and speak to big groups and different things like that, or even when I do patient education within the hospital, I say, okay, so you noticed that change and you thought, well, I'll wait a little bit, and you didn't come quickly. Most patients tell me, yeah, I wish I had done things differently, or I wish I had known that I should call 911.
Right. And Marie, it's interesting as I'm sitting here listening to you and we're communicating this to, our population in Arlington. I mean, strokes can happen at any age. I just think it was within the last few weeks, there was a 32-year-old teacher I'm blanking on the name of the community, but she had a stroke and she died.
Right.
So it really can happen at any age. I think the incidence is probably greater the older you get.
Correct. Well, the older you get with anything, you might have other conditions, high blood pressure, high cholesterol, diabetes. You need to manage with your physician what your other risk factors are.
And that is something that if we can talk just a little bit about, because the Council on Aging has a number of different programs, a number of different partnerships with health organizations as a total health and wellness, because a stroke maybe doesn't necessarily happen without some of these other underlying conditions.
Correct.
So if we could just maybe in general go over some of the things that exist in individuals again that could be a potential leading up to stroke.
Risk factor for stroke.
Thank
you. So blood pressure.
Okay,
huge.
So blood pressure, huge. So the Council on Aging, for example, does weekly blood pressures on Tuesdays.
Great.
We also go out into the community when we also have nurses that are visiting us from colleges and universities.
Yeah.
So we try to do those. So blood pressure.
Blood pressure.
What is considered now a normal blood pressure? Something that doesn't have to
be treated.
Be treated.
Right. So that number keeps actually dropping. It appears more and more because of the higher the blood pressure. And we won't get into the physiology of it, but the higher the blood pressure, the more damage it causes to your internal vessels. And then untreated blood pressure over a period of time really puts a strain on those blood vessels.
Right, and actually high blood pressure is a silent killer.
Correct.
You often hear that.
Everyone says, I don't have blood pressure. I didn't know I had high blood pressure.
I don't feel it. I didn't have a warning sign
I
pop
didn't
up.
feel it.
I didn't feel it. Absolutely.
They do feel it, but they don't feel it, right?
Right,
Correct.
right. It's in denial. It's dismissed for other kinds
Correct.
of things.
Yeah.
So what are some of the other risk factors?
So diabetes is once again, because of the vasculature of the body, diabetes puts a tremendous strain on the vessels.
Right.
Puts you at a higher risk for stroke.
So that would be type 1 and type 2. So type 2 is the predominant of the diabetes, even though type 1 is actually more challenging.
It is more challenging at a younger age.
At a younger age.
Correct,
and so type 2 diabetes. So the Council on Aging, for example, beginning in June is having a program just for type 2 diabetes.
Great.
It is a 13-week program. For anyone listening to this program, you need to call our office to put your name in for consideration. So they're going to have 13 weeks of education. They're going to have 4 weeks of nutrition training. There will be testing A1Cs at the beginning and at the end, just because we're there for 13 weeks. So we'll be able to be able to do that.
Wonderful.
They'll be able to have a free membership with the Woburn Y for 13 weeks.
Wow.
So it's all inclusive in terms of education, nutrition.
It's comprehensive.
It's comprehensive. And I think the toughest thing with diabetes too, high blood sugar is also a silent killer, because it attacks the body differently. Now here I'm speaking as though I'm a nurse, so you just jump in and tell me I
no, it's-
manage the Council on Aging
right,
and I'm
sure,
not in medicine. But
sure.
the key with this is that diabetes attacks the body in a different way than high blood pressure. And diabetes attacks just about everything.
Correct.
So
Yeah.
so that's very important
is.
to acknowledge that it is a risk factor for strokes. And again, the Council on Aging is doing some of these programs. We've partnered with Leahy
yeah.
in order to do this.
Great.
And so, we're out there to try to help you manage your disease and live a very dignified and
Healthy
independent life and
as you
healthy life.
can.
Because I'm
Yes.
not really sure you want to see Marie again when she's in scrubs and at the hospital.
right,
But if you
yeah,
do, you've
right.
met her here.
You can say, "I
so,
saw you," yeah.
So all right, so Marie, so we've talked about high blood pressure, we've talked about diabetes. What are some of the other risk factors that?
High cholesterol is one.
Okay.
I'm sure usually at annual checkups, your doctor probably will do some sort of a lipid panel just to see. Atrial fibrillation, or AFib, that we
Okay.
call it, that irregular heartbeat. Sometimes people live that they don't know it, but they feel some sort of what we call an aflutter. They feel some sort of a change in the rhythm of their heart.
Okay.
So that's a very, very high risk.
All right.
Let's see, weight. People that are more obese people have a higher risk. It's just because of all of the stress that it puts on all of your body. Smoking, huge.
Huge.
Smoking.
Huge.
So we really want to try to get that education out there, especially we see more younger kids kind of starting to smoke. High school and college age kids are starting to smoke again, and it's just terrible what it does, to the internal body.
Right.
Ages you, and it just, once again, the vascular system and
And for
different
those
things
youth
like
that
that.
are smoking, it ages your parents as well. So please have sympathy.
Yeah, right.
So are there any other, in general, risk factors or
Family history.
family history?
Parent, grandparent, sibling, put you at a little bit of a higher risk. So what we try to do is sometimes we put a little spreadsheet together when we go and speak with patients, and we say, okay, so you had high blood pressure and you have diabetes and you have a family history, so you sort of have a high risk for stroke, and now you're here because you've had a stroke. So now we want to work with you to try to reduce your deficits and get you back to the quality of life that you had before. I'll just mention quickly, there's another mini stroke, they call it, or a TIA, a transient ischemic attack. So we see a lot of patients that come in and they've had these little events that they call them, little events where they feels like they're having a stroke and they have those symptoms of a stroke, but then they go away.
Okay.
So you may have slurred speech, or you may have that weakness, or usually it goes away within 5, 10, 20 minutes, something like that. If you think you've had a TIA, you want to talk to your doctor.
Do you want to speak to your doctor right away, or do you want to wait for that appointment? Oh, by the way, that's 3 weeks from now.
No, you want to call them right away.
I need you to really hear that,
Right.
because what we hear oftentimes, Marie,
they
is that
wait.
someone has an ailment of significant proportion, and I'm sorry, no stroke is a little stroke in my book.
True.
And
Very true. Yep.
I don't mean to be flip about it, but when
No.
I kind of chuckle inside of my head, because when they say, oh, I just had a little stroke, it's like, really? It's an assault to your brain.
Correct.
It's nothing little about that.
Absolutely.
But the point is that you want to be seen right away.
And we have a lot of patients that come into the hospital
Right.
because they have that sudden change.
Yeah.
They know something's wrong. They're not really sure. Sometimes they still have it when they get to the hospital, but then during the course of our evaluation, it goes away.
Right.
So we keep them in the hospital just to evaluate them. Usually overnight, we run some tests, and then we discharge them. That's usually a quick. Sometimes patients have it at home or wherever, and then they sort of ignore it, and they come in and tell us, well, I think I had a couple of those. Right.
Yeah.
So,
So again, time is brain.
time is brain. You want to
And
get in as quickly as possible.
exactly.
Or be
whether
evaluated.
it's something as significant as what we've been talking, or if it's the little stroke, which again, you're not going to hear me say little stroke.
Right, no, absolutely
But it
not.
is for some reason
Right.
referred to as that. Now, are there any other things that we might not have covered?
I don't think so. I think, you want to make sure that you manage whatever health concerns you have. If you have that change, you want to talk to your physician. There's one thing that I'd like to say that I say in every presentation and in every person that I speak to, If you're on daily medications, your doctor prescribed them, you're on daily medications. Just because you're feeling better or you think you don't need them anymore, you don't want to stop them. Because I have seen hundreds of patients that have stopped taking their blood pressure medicine, or perhaps stopped taking their aspirin, or stopped taking whatever it is that their doctor prescribed for them that they felt that they needed, because they felt better or they didn't think they needed it anymore.
Right.
And they come in and they see us, the hospital, or me, because they've had a stroke. So it's very important not to stop your medication unless you have a conversation with your physician and you have an agreement, or they tell you why you should not stop.
Right. This has all been very helpful information. So we know time is brain. We know that between the point of an initial change, whether it's in face, arms, speech, that it's roughly 3 hours. So when you first feel it, you need to call 911. You need to get to the hospital. You need to let them determine whether
Correct.
it's a stroke.
Yep.
You need to let them go through their process. And if you've ever been in an ER and you know that they're waiting, and I've actually been with someone where the call came through, that the ambulance knew we were coming, I mean, that
Somebody was coming in.
somebody was
Yeah.
coming in, and you're met with your new best friends for the next few hours. And hopefully the outcome would be good,
Right.
you know, from that interaction.
We want people to know that when you come to the hospital, people don't want to go to the hospital.
Right.
But we're there to save your life or help you
Right.
in a time of need.
And the one thing that I have to bring up that we didn't bring up before in terms of the list of objections, many folks don't want to go by ambulance because there's a cost. It's going to cost me money. So what I can say is time is brain. The decision you're making right then and there could make the difference of whether you're living at home the way you're accustomed to,
Correct.
or having a significant health change where you have to modify your home significantly to manage paralysis or some other neurological deficit.
Correct.
It isn't nice.
No.
Or you may end up in skilled nursing as a result of the decision because you don't want to spend the money. You always need to be reaching out to the Council on Aging for resources. We're there for health and wellness, we're there for social services, we're there for information and referral. We also have a SHINE counselor, so SHINE is to help with Medicare as well as Mass Health. We have
that's
3
great.
SHINE counselors that are dedicated to the Arlington Council on Aging. That's free of charge to get information. So don't let that dime make the decision for time is brain. So I just want to recap on FAST. So FAST is in each, and I haven't studied it, Marie just brought it up. So FAST is a change in face. So if the face is slightly drooping,
Symmetrical.
symmetrical.
Yeah.
So if you're home alone, you go to the mirror, if you smile and it's not even on each side, symmetrical, that's the time. If your family member is wondering, get their attention, don't let them be dismissive of what you're trying to do. Arms. If you have a weakness in your arm and you can't put your arm out, or if it droops, that's the time. Again, time is brain. The other thing is speech. If your speech is slurred, if your speech is much slower than normal, let's just put it that way.
Garbled, it doesn't make sense.
That's the time to do it. Our emergency services in Arlington, as well as all over the United States,
Fabulous.
you dial 911 at any time. We hear objections that folks don't want to wake them up. There are different shifts of individuals. So there's a daytime shift, an evening shift, and an overnight shift.
Correct.
So when you dial 911, you are not waking anybody up. You are actually engaging them in the middle of the night.
Right.
And they will be there as quickly as they are during the day. So do not wait. Time is brain.
Correct.
I just want to thank you very much. Certainly the Arlington Council on Aging is very grateful to the relationship that we have with Mount Auburn, the grant that we have to fund some of the initiatives that you'll be seeing in the next 12 months for stroke awareness, and hopefully that will be stroke prevention as a part of the awareness.
Right, absolutely.
This is the month of May, so it's Older Americans Month, so time is brain, older Americans. And this is the month that you're going to be hearing a lot, but we hope that you incorporate FAST and time is brain in every day of your life. Marie, thank you so much for joining us.
Thank you.
Thank
Appreciate
you.
it.
Have a nice day.
Jenny and her grandma May on an ordinary day. When there in the kitchen, Grandma started to sway. Grandma sounded strange when she spoke, and Jenny had to ask, what if my grandma's having a stroke? I think I better act fast. I think I better act fast. Does her face look a little bit uneven? Does one arm drift down? Is her speech coming out kind of strangely? Then it's time to call 911. Jack and his favorite friends were having lunch in town. When Hank looked up, half his face drooped down. Hank wasn't making a joke, and so Jack had to ask, what if my buddy is having a stroke? I think I better act fast. I think I better act fast. Does his face look a little bit uneven? Does one arm drift down? Is his speech coming out kinda strangely? Then it's time to call 911. Helen and Bob were walking at their favorite time of day. Helen turned to Bob and said, my arm is not okay. Her arm was limp inside her coat, and so Bob had to ask, what if Helen is having a stroke? I think I better act fast. I think I better act fast. Does her face look a little bit uneven? Does one arm drift down? Is his speech coming out kind of strangely? Then it's time to call 911. Stroke can happen anywhere, morning, noon, or night. And every minute after that, more brain cells die. Our heroes acted quickly, and so they all have hope. Precious time and emergency care, you can beat a stroke.